Good evening, everyone, and welcome to the meeting. My name is Sarah Woollett, and I am the General Secretary of the Bakers, Food and Allied Workers Union. We represent people right across the food industry, and the majority of our members have worked throughout the pandemic, keeping the nation fed as the key workers we've always known they are. And I'd like to thank all of our branch health and safety reps for the fantastic work they have done over the last 12 months, challenging those employers not doing the right thing and making their workplaces safer as a result. Tonight's meeting, held by Zero COVID and the Hazards campaign, is named Resisting Unsafe Work, and we are asking the question, how do we make sure our employers are controlling all the risks of COVID-19 infections in our workplaces? We have some fantastic speakers from across the labour movement who are going to talk about the fight for safe workplaces, and we will discuss what workers can do to pressure their employers over safety measures and the key demands we need to be making on the UK government on issues like sick pay and PPE. Before I introduce the speakers, I have a few housekeeping rules to read out. We are live streaming and recording the speakers at the start of this meeting, but we want everyone to feel comfortable to discuss issues in their workplaces, so we'll turn it off before the discussion. It will appear that we are still live streaming, but that is only for the transcription service for disability access, which has no video, audio or names. We have Zoom subtitles visible by default. You can hide them or access them as a full transcript by clicking on the CC Live transcript button within the Zoom meeting. On some devices, this button may only be visible after you click on More. On an iPad, look under Meeting Settings. Additionally, a better quality automated transcript is available by clicking on the Live button within the Zoom meeting and opening the custom live stream. Zoom chat can be distracting and a barrier to accessibility for some disabled people. Zoom currently has no option for users to choose to fully hide it. As a result, the Zoom chat is disabled for participants and will only be used for the facilitation team to post messages. However, we have provided a separate discussion page where you can post events or discuss what speakers are saying. The link to that is being posted in the Zoom chat now. Everyone was muted when they entered the meeting. When we get to the discussion, you will be able to unmute yourself, but we ask everyone to stay muted, except when speaking, please. Thank you. I will now introduce our speakers. We have Janet Newsham from the Hazards campaign, Amin Hardy from Salford Unison, Tracy Edwards from the Public and Commercial Service Union, PCS, she's the National Health and Safety Officer, and Dr. Emma Runswick from Zero COVID. Our first speaker is Janet, and I will hand over to her. Thank you.
Thank you so much for your introduction. And I'm really pleased to be here. I'm going to share my screen, if I can do it. There we go. Okay. So just to say, I work for Greater Manchester Hazards Centre and part of the Hazards campaign. We're an campaigning organisation on occupational health and safety. And obviously during this the pandemic, we've been working quite hard to try and support workers and support trade unionists on health and safety issues. But just to say that before the pandemic, you were twice as safe if you worked in a workplace with an active trade union. And throughout this pandemic, safety reps have been saving lives. We've got a fantastic lineup of speakers who'll tell you some of the inspirational challenges being made to unsafe work by their members. And I've been inspired by lots of actions that have been taken by safety reps and workers to keep themselves and their colleagues safe at work. And also terrified, I think, by the government's inadequacies and lots of employers and the way that they've treated workers. And what's happened to workers is that those on precarious contracts have been forced in and out of work. They've not been able to object or raise health and safety issues. They've not been paid sick pay, which has meant that many of them have been in work unable to take time off work, even if they're ill. And as a result of that, thousands, not as a result of that, but as a result of the way they've been treated by employers, thousands have died because the employers haven't controlled the risks to their health. and because transmission rates were so high. And we know that PPE standard across the UK has not been at a precautionary standard. We saw it being lowered at the beginning when they didn't have enough PPE available. And non-essential workplaces have remained open, so things like construction have remained open throughout the pandemic. And also the HSC, the Health and Safety Executive, the enforcers of our health and safety in workplaces, have locked down at the beginning of March and discouraged reporting. They set up a privatised call centre, and in reality there's been hardly any enforcement of our health and safety law, and certainly been lacking. And you know, the independent SAGE said most workplaces are not COVID safe, but that's what we'd say, that most workplaces haven't been COVID safe. And health and safety laws are supposed to protect us in all these areas, in work, in public transport, in our houses, in this, when we go shopping. All these places are covered by employment law. I just want to briefly, I'm not going to give you a big law lesson, just briefly outline some of the things that we should know really about health and safety law. So health and safety law has not changed during the pandemic. This is the Health and Safety at Work Act, is the enabling act. It gives general duties to employers and everybody else in workplaces and those that provide services. And this is just some of the legislation that there is in health and safety. But it's not changed, but government issued guidance which was lower or weaker than the law. And when it comes to, if there's legal cases that are taken, then employers are going to be accountable to health and safety law, not government guidance. So there's lots of things that we should be aware of within the law, that things like the risk assessments that you've heard been talked about, there's an absolute duty on our employers to do suitable and sufficient risk assessments. So this isn't you don't have to do it. They have got to do it. It's an absolute duty on them to do it, and they have to be carried out by competent people. And there's a definition of competency in the health and safety website. Employers must establish a serious and imminent danger procedure. That's under the Regulation 8 of Management Health. So this is separate to the Section 44, Section 100 serious and imminent danger. There should always be this procedure in place. It's been used before. If there's a fire in your workplace, what happens? But actually, through the pandemic, this is something that should be established. And just to mention that if you've got a safety rep, then your employer has got a duty to consult them. So that's why we say you should elect safety reps. Face coverings that the government talk about, that everybody wears outside or doesn't wear, they're not PPE. They're not a precautionary standard that's acceptable in workplaces or by workers. And your employer's duty is not just to your physical health, but to your mental health as well. And because there's lots of non-reporting going on, there should be paper trails of everything. So make sure if you're asking your employer for risk assessments, etc., do it in writing. Let's keep paper trails going. Okay, so we should all be aware now that transmission routes of the virus are by direct contact, indirect contact, by large droplets, that's your coughing and spluttering, and by aerosols. So that's the most important route, and that's what our employers should be controlling the risks of. Perhaps just to mention that there's new guidance that's just been produced by the World Health Organization that you might find interesting. But we've got lots of information, and when we've Hazards Campaign, Hilda Palmer and the Hazards Campaign have done a big article in Hazards magazine, and we've got she did a webinar for TUC, which is brilliant. And if you go onto the Hazards Campaign website, you'll see that. So risk assessments and COVID-19, well, if you go onto the Health and Safety Executive website, you'll see what employers should be doing. And all it is to identify what hazards there are, decide who could be harmed and how, and evaluate those risks and decide on precautions and record those findings. And actually, if there's 50 people, they should be putting them on your website. That's what the government said would happen during the pandemic, and then implementing them and then reviewing them when things change. So that's if there's new information comes out, or if if new information or the variant, if there's new variants, then they should reassess those risk assessments. This is from Canada, but it's just as relevant to us. Your employer, when they find a risk, so transmission risks in our workplaces, they should use a hierarchy approach to it. So does that job need to continue? Can it stop as the first thing that they should ask if a work activity is putting you at risk, if you're at risk? And then if they can't stop the job, can you do it in a safer way? So can you work from home? Can you teach from home? Can you teach online? All those things, they should be looking at. That's the next priority. Then thirdly, is there engineering controls? So with the aerosols, with airborne transmission of the virus, they should be looking at increasing your ventilation. And we've got some really good information on that on the Hazards Campaign website. So increased ventilation, it might be putting up like blocking off on buses, to make sure that you're separated from anybody that comes onto the bus, that sort of thing. Or in reception areas, they might be putting up some sort of perspex screens that are sealed off. And then thirdly is their admin controls. So this isn't just about a one or anything. If you're going to be in workplaces, if you're going to be at risk, then they should be looking at a layered approach to controlling those transmission risks. So ventilation, it should be one-way systems, it should be distancing for the droplets, not so many people in for not so long. It should be put in place, it should be increased cleaning, and it should be increased and improved hygiene. And finally, the individual control is PPE, and that's why it's last. So all the others are collective controls, and the last one is PPE, and it should be at a precautionary standard, FFP2 minimum and FFP3 for high risk. This is a bit about ventilation, and just to say, the more outside air that you get in, the better. And that's just, a quick stab at it, but there's lots of information about what that means and how much is better. And if you can monitor it with CO2, or you can introduce mechanical ventilation, turn off fans in rooms, avoid opening windows in toilets, but keep toilet ventilation on all the time. So all those sorts of things are useful to keep you safer in workplaces. And there is some stuff on the HSE website. This is not particularly good, but there is some examples of risk assessments that you can look at. And you should be aware that it's not only deaths that we're worried about. It's obviously lots of people are going to end up with long-term ill health as a result of COVID, and that'll be long-term disabilities. And so that's another reason why it's really important that we get our employers to report them, and we get our employers to record them in accident books, any infections, any near misses. So what do you do if your employer's not controlling the risks? First off, make sure you're in a trade union, elect a safety rep, and contact your trade union. That's the best thing that you can do to be safer in a workplace. Safety reps have the right to be consulted. They've got lots of rights to be able to inspect and to support you. If your employer refuses to consult on risk assessments or refuses to share the risk assessments, then it needs to be escalated. You need to put in a collective grievance, and then you need to escalate it to the HSE and local authorities. Some workplaces are enforced by local authorities and some by HSE. And these are the web pages on the HSE for reporting. If you're a safety rep, you can report it direct. So in summary, what we need is more safety reps. We need more active safety committees. We need to scrutinise and hold our employers to account. We need safety reps to do inspections, to become more organised. We need to improve ventilation, escalate if we're not getting a satisfactory response. Only code safe workplaces should be open. And we need to be campaigning for zero COVID, and we'll listen to Emma later, who's going to be talking about that campaign, and absolutely support any solidarity action that's coming up. It's a Swiss cheese respiratory virus pandemic approach that we need. And it's all those things. It's safe workplaces, it's physical distancing, it's wearing masks, it's wearing improved hygiene. It's about governments providing proper financial support. It's about reducing community transmission. And it's about the testing and tracing being put in place and working effectively. And we've asked for 5 days of action this week. have a look on the website, Zero COVID website, and see what action you can take. And that's it. Thank you very much.
Thank you ever so much, Janet. I think some of the important things there were lots of important information, but I know something that we've experienced as a union is employers deciding because of the COVID pandemic they couldn't possibly meet the health and safety reps to have discussions about being healthy and safe in the workplace. Someone's asked in the chat if the slides can be made available after the event. Is that something that we can do?
Yeah, we'll put them on the Zero COVID website, can't we? And we can put them on the hazards campaign website for people to get. Thank you.
Great, thank you. And somebody else has mentioned that they've witnessed cancelled health and safety courses because employers don't want people to know the rights. And you're right, that is a way of them controlling you. And that is why it's important to attend such sessions like this, because you can get the information that you need and have discussions and learn from each other. I will swiftly move on to our next speaker, Amin Hardy from Salford Union. Oh gosh, I don't know, Unison. I'll put my teeth back in. I'm having one of those days today. Apologies, Amin. Do you want to come in and speak? I can't see you. I'm not sure where you are. I did see you earlier. If not, we'll move on to Tracy Edwards from Public and Commercial Services Union and come back.
Can you hear me now?
Yes,
Sorry.
yes, we can. Thank you.
Apologies, I didn't know I could unmute myself. That's my own fault. Should know better. Yeah, my name's Amin Hardy. I'm from Salford City Unison branch. I'm also Northwest Unison Chair for Black members in Unison. And I suppose I'm going to give you a little bit of, experience about what's happened within my setting. My branch is a local government branch. That means the main employer is the local authority, the council. But we also have bits attached to us that were previous years or pre-austerity or even pre-Thatcher were part of the council, like social care, that are now privatised, that we have a section of membership in as well. In fact, obviously, they were in the most dangerous situation during the pandemic, and I'll talk a little bit about what we did around that. Our council workforce is split between those that have been working from home since the pandemic started, and those that are in jobs where it's not possible to do that. Residential care, bins, refuse collection, that sort of stuff are face to face. So I suppose it feels like we've been in a battle around health and safety for almost a year now. And I say that because the government made it clear from the very start with herd immunity that they didn't seem to care about people dying. And that's probably been consistent in terms of the way they've dealt with things throughout the pandemic. And the implication for workers is that knowing that your government doesn't care about you made them question whether their employer cared about them. And I think because the government was so slow to react in the beginning and wanted to follow a strategy of herd immunity, meant that we went through quite a large amount of recruitment and to the union as well as organisation in the first few weeks. It was obvious to us to see that, given events in China and then in Italy, that we were heading for a pandemic. The only people that didn't seem to see that was the government, and our employers said that until the government decided to do anything about it, they weren't going to do anything about it. And I suppose there were a number of battles that took place. I mean, it feels strange to share some of this stuff now, but there were actually managers that called team meetings, called staff all together into one small room to discuss with them how they should deal with the pandemic. It seems crazy now. I remember in one team, the service manager called them in and told them they were in Team A or Team B. And if you were in Team A, it meant you were going to continue to work from the office. But once you'd all got COVID, then they'd swap you out with the people in Team B that would be working from home. You can imagine how the staff reacted, not being warned in the first place, to find out that they were going to get COVID and that they were going to be putting their families at risk and that they had no choice about it. All these things led to, and I think in one place where it was a unit involving both staff and young people, they called a meeting of over 40 staff together into one room. I think 3 days later, half the staff had to go and self-isolate because one of the people in that meeting had COVID already. So these are some of the crazy things that happened at the start, which meant that people immediately wanted to speak to the union. And what tended to happen was that staff group used to contact us, explained they couldn't safely distance in their workplace, explained it wasn't possible. And then we placed the demand on management to shut down that building. And within maybe 24 hours, those workers would have had their first union meeting, elected their first rep, and would have shut down the building all within 24 hours. And it was quite that quick when it happened. And I think we probably recruited 15 to 20 stewards in the space of 2 to 3 weeks. I'm not great at IT, but we all got very used to using Zoom very, very quickly. And I think the pattern that's followed that, particularly around schools, mirrored that kind of feeling that actually both the government and the employer are not considering their best interests, and that they need to then consider how they organise. And obviously, as a branch, we encourage them to collectively organise, elect a rep, and then start to challenge the employer on that basis of collective action. I think in terms of the year, I think as a branch, we probably recruited about 400 members in the last year, to give you an idea of the scale of it. And we've got probably now somewhere in the region of 30 to 35 new reps, mainly in schools, but yeah, that sort of level of organisation. And I think the concerns have always been that really the whole approach by the government is when they do act, it's because they're forced into it, and they act by locking down. Now, and they make out that somehow it's demand from ourselves to lock down. I think the demand from ourselves is for them to have proper PPE made available. The demand for us is for them to have a proper test and trace system, which they still haven't got a year in, having given billions to private companies to run it. I think our demands are somewhat different than whether we should be locked down or not. Our demands are about how safe is it for a worker trying to deliver a service in a situation where often the government tells our staff that what they should care about is targets and budgets rather than their health and safety. And not just the health and safety of them, but the implications it has for the community. Because if you're a social worker going out on visits, to be in a situation where you may be a spreader as well as you may be a victim of catching it is not a good position to be in. We've had various attempts to try and force our employer to record the amount of people that have believed that they may have contracted COVID through work. And, you know, at first our employers said, yeah, they would share that information, but they never have. And it's one of the things that shows you, and I suppose highlights to staff, that there's only a limit about how far they're willing to consider your health and safety. And it brings us back to the need to be able to organise. The other part that I want to cover briefly is just around social care.
Just briefly, because you're well over time now. But if you
all right, sorry, be really brief. Apologies. Just on social care, very briefly. What we did is we organised our members to try and force the employer and the council to do something special around it, because they knew the risks of spreading it when people couldn't afford to be off work was so great. And the council and the NHS agreed with us, and they offered anyone that had COVID full pay, not 80%, not anything else, full pay while they were off. And we've tried to maintain that line. We've had difficulties with employers not willing to take the money, even though the council and the NHS are willing to give it to them. And we managed to renegotiate that deal now, so it's still in existence today, that any staff that goes off, one of the arguments is people can't afford to self-isolate. Well, in Salford they can. The problem is only with private employers that don't actually implement, take the money that's been offered to them by the council and NHS. So sorry I didn't get to cover that in any detail, but I'll leave that there. Thanks for your time, and hopefully you found that interesting.
Thanks, Amin, and sorry for interrupting you. We'll bring you back in the end, so maybe you could give some more information about it then, if that's okay. Cool. I think you made some valid points about the government being very reactionary throughout the whole of this. They've not planned for anything, and the guidance that they've put out has been shoddy at best. I think that's the most diplomatic way of putting it. Our next speaker, I'd like to introduce Tracy Edwards, who's from the Public Commercial Services Union, PCS, and she's their National Health and Safety Officer. Welcome, Tracy.
Thanks, Sarah, and hello, everyone. Like everybody else, our union has been, exceptionally busy this year. We've been battling the civil service and employers within our union to try and get as many people to work from home as possible. And as Janet says, health and safety laws have gone out the window. It's been an absolute disgrace. However, one point to make it at this stage is that if unions didn't exist, then the situation would be a lot worse. And when Johnson announced his roadmap in Parliament recently, when he, in his usual buffoonery style, he said that it's unfortunate, but unfortunately there are going to be more deaths, probably in the summer or September. But it's going to be an unfortunate reality. We have to open up the economy. We have to get everything going again. So that was his term of phrase. Unfortunate. But for the rest of us, the death of a relative, a friend, or a work colleague is absolutely devastating. And I think that's not that's not going unnoticed by the vast majority of people in this country. I think that's the difference between us and them in all of this, and it really kind of sets out what's at stake, doesn't it? As well as the health and safety issues, the kind of the safety issues that we're talking about in the workplace, the psychological fallout from all of this is going to be huge. The fact that yes, we're in an unsafe working environments, but we're also living a very inhumane life at the moment. We're living in a situation where we're not, our basic sort of human needs are not being met, and our civil liberties are being clamped down. And I think that if we continue to have these absolute clowns in charge of things, then I think things are only going to get worse. In my union, in the PCS, we're looking at setting up a mental health, a mental wellbeing forum to first of all to find out how our reps are coping with the situation, but to develop demands around how work should be managed and how work should be organised in the future. In the civil service, we have about 25 ministerial departments. We've got a further 20 non-ministerial departments and over 400 agencies and other public bodies, and yet the civil service nationally has taken no responsibility for health and safety for people who work in the civil service. They leave it all down to individual departments. So we've ended up in a situation where every single department is handling things in a different way. In fact, the civil service nationally are trying to argue against our belief that not our belief, but actually set out in the health and safety regulations, that every single workplace, especially if it's a multi-employer workplace, should have an established health and safety committee as per the management regs in the civil service are actually trying to challenge that. They're saying that they're taking legal advice. But what I wanted to draw out some examples of the contrast really that this approach does. You'd think that the civil service would have one approach to health and safety, but it doesn't. So departments like the DWP and the HMRC invested in new kit to get as many people working from home as possible. It wasn't perfect. The union had to fight, particularly in the DWP, to get more people to be working from home. But you know, they were doing it, and they have done it. In comparison, and I would urge everybody on this call tonight to take a look and see what's happening at DVLA in Swansea, which is the civil service department that holds the main database for driving licences in this country and does all the administration for it. Because essentially that employer, the DVLA in Swansea, which is the biggest employer in Swansea and has no doubt in my mind contributed towards the increase in community infection rates, has refused to do the same. So they still have hundreds of workers working in their buildings, in call centre environments, etc., etc. And the result has been that nearly 600 people who work for the DVLA in Swansea have tested positive for coronavirus since September. In addition to this, the conditions, apart from being a breeding ground for the virus, it's also detrimental to their well-being. They're continuing with targets in the contact centre. Workers are having to take their breaks and their lunches at their desk, and workers are constantly worrying about how safe the place is. And it is an extremely toxic and bullying workplace to work in. There's micromanagement and there's bullying that's going on. Our members are too scared to be identified. And all throughout this, when we were challenging the DVLA, right up until the end of last year, they were continuing to blame individual workers, saying that they must have been out partying, that's why we've got some cases in the workplace. So that's the contrast. We're currently balloting for action over safety there. But really there are long-term issues to fix with this employer. And I think that this is a common theme, that things were bad before, but the pandemic really has brought everything into sharp focus. Employers and government have completely disregarded the laws Janet has pointed out, i.e. the Health and Safety at Work Act. But this process has been taking place over a number of years. We remember the Tories talking about cutting red tape and all of that sort of stuff. And I think that, you know, we can see, you know, very clearly that employers are just dodging their health and safety responsibilities. They've hidden behind inadequate Public Health England advice and HSC guidance to say that their workplaces are COVID secure, a term that makes absolutely no sense. I think it's an absolute nonsense. But what we need to be doing, I think, is that we need to be defending those basic rights to a safe workplace. That means enforcement. That means enforcing our rights. And that is the key issue in all of this. You know, we were fed up with the excuses employers are given. I think that the safety issues also apply to those who are working from home. We thought it was a temporary arrangement last year, but now this is a long-term arrangement. And depending on what your house is like, you know, you could be a flat share, you could be sitting on the edge of a bed, etc., etc., etc. The situation again is becoming insufferable for many people. We're seeing an increase in alienation. And we're also seeing inadequate working conditions. It is suiting some people to work from home. But what unions need to do and what we need to do is to make sure that we are setting the agenda and not the employers. I'll give you an example.
Sorry, if you could wrap up, please.
Oh, God, Sarah, I've not...
Well, right, you'll bring you back in at the end, so you've
yeah, got... okay, all right, okay. I'll leave it there. Well, the only thing I was going to say is that I wanted to mention about International Workers' Memorial Day. I know that the Zero COVID campaign has got a day of action planned for the 13th of March, and I would encourage everyone to look at that. But we also have International Workers' Memorial Day, which is coming up on the 28th of April, which is a yearly event where the trade union movement remembers those who have died and has a theme each year. But this year, the theme is going to be occupational health and safety should be a fundamental right. And I would hope to see that we can, as a movement, maybe coalesce into some sort of, I don't know, national event or some sort of national demonstration. One of the things that we're looking at doing in the PCS union is we're looking at asking employers to read out the names of work colleagues who have died over the past year, and for the union branch to be, holding a little kind of memorial session, a bit like what happens during, on Remembrance Day in November. So we're going to be pushing that. But just to say that, from my point of view, I think this is and has been throughout the whole saga a class issue. The lower you're paid, and depending on what background you're from, places you at a higher risk. The rich and wealthy don't care. They live in luxury, and if anything was to happen to them, they have that safety net. This government needs pushing back. We can only do this if we link all our struggles together, both in the movement and in communities. And it's about time that they felt, they felt the heat and they felt the flex of our collective muscles. So solidarity, everyone who's in struggle. So all the victimised trade union reps out there. Let's also remember the dead, but fight like hell for the living. An injury to one is an injury to all. I'm really sorry, Sarah, I didn't realise I went over so long.
It's all right, not a problem. Thank you, Tracy. And I think that was a fantastic way to end, highlighting Workers' Memorial Day. And I'm really glad you mentioned the DVLA in Swansea, because I was on with Mark on my last call before I jumped onto this one, and he mentioned it. And, it's what that employer's doing is disgraceful. What it continues to do now, it continues to put those people at risk. And we've had similar experiences with employers blaming the workforce for the COVID outbreaks on sites, not actually having any accountability or wanting any accountability for themselves and their own shoddy practices. So thank you for highlighting that. We'll move on to our last speaker before we open it up for wider discussion. And this, I would like to welcome Dr. Emma Runswick from Zero COVID. Emma, over to you.
Thanks, Sarah. I think we've heard quite well from the other speakers about what is possible to do in your workplace, from shutting down offices in 24 hours to having ballots over health and safety issues at the DVLA. And there's lots of examples across the country of people doing quite dramatic and impressive things, including recruiting huge numbers of members and organising at a pace to make safety changes to their workplace. And we know a little bit about how to achieve it from Janet. And what needs to be done still. So we've got obviously the problems at DVLA, but we've also got problems in lots of other workplaces, both necessary workplaces that need to stay open but haven't got appropriate safety changes made, but also workplaces that are still open and need to close. So I suppose my points are going to be about why this is important. Why is having safety at work from COVID important? And I'm a junior doctor in the Northwest, and that makes my perspective, I suppose, quite obvious. COVID-19 is a virus that kills many people, including people who you might not expect it to. We've sent 35-year-olds and 40-year-olds to ICU in my hospital, but also many that you would. So the poor, the disabled, people from Black and Asian and other minority ethnic backgrounds are far more likely to die. And then, of course, it causes long-term impairments for people who survive it. Many more people. The early data from the Office of National Statistics on long COVID shows that we have a 12-fold increased risk of stroke, a 9 times increased risk of diabetes, a 10-fold increased risk of kidney failure. And those are long-term disabilities for people. And that's before you even get to the muscle aches, the brain fog, the fatigue that are affecting lots of people in work and in their home lives. And this is working age people predominantly who get long COVID before they've even passed it on to their colleagues, their family members who could die of it. We know from the HSE that there's been more than 3,500 outbreaks at workplaces, and the new roadmap has no plan whatsoever for dealing with workplace-based outbreaks at all. And as Tracy outlined, they expect that there will be 30 to 80,000 more deaths. And again, it's not going to be them that die, it's going to be us. It's going to be us that die. More ill, more dead, more of us who are going to be who are poorer, worse off, more of us who are black, and more of us who are disabled. And that fundamentally undermines the efforts of having lockdowns and the excellent vaccine efforts. It's why my trade union, the British Medical Association, has literally committed to write to employers that don't have safe processes at work to shame them into being more active, and then also to the press if necessary. It also draws sharp relief to the fact that why this action at work needs to be part of a wider movement for a different strategy. Whether you call it near elimination or max suppression, we call it zero COVID. Zero COVID is a completely different strategy to managing a pandemic that values lives and livelihoods over some kind of nebulous economy or getting back to normal, even though it is actually the best at getting back to normal, as we've seen in New Zealand, Vietnam, and other places. We are in a better place in terms of awareness of zero COVID, but Johnson and the UK government are still arguing for a containment strategy. We know that from National Education Union and others that workers' action has a policy impact. The more of us that take that kind of action in our workplaces, the more likely we are to change the government policy and reduce the number of deaths and the amount of ill health that we have in our population. So what do we need from you? We need you to take zero COVID into your workplace and into your union. This is the first event in a 5-day course of action against unsafe work. There's information in the chat, and you can link in the chat about our campaign on unsafe workplaces, and you can find us on Twitter and Facebook as well. You can sign up to the Zero COVID campaign as an individual, but also you can sign up your trade union branch and access support from us and play a part in this campaign, shaping this campaign. We have lots and lots of resources for your union branch to help, both from hazards of the kind of stuff that Janet was talking about, but also support, so you can more easily contact people like me and others. And then again, on the 13th of March, we have a day of action, which will include an online event and safe local protests across England and Wales. And Zero COVID Scotland is launching on the 13th of March, with a specifics focus on the devolved government there. So there's lots for us to do as individuals, as collective branches in our workplaces, in our unions. There's stuff to do politically, writing to our MPs, involving ourselves in party political processes, and doing things that we need both at work and in wider society to get ourselves to zero COVID, to save lives and to save livelihoods. Thanks.
Thanks, Emma. And I think you've really kind of given a bigger picture about how people can get involved. You know, whether you're working from home and you are on your own at this moment in time, or whether you're in a workplace, there's something that everybody can do to help get to COVID zero, which is fantastic. Thank you to all the speakers.